The Gorakhpur tragedy demands a prompt inquiry and a holistic healthcare overhaul. As exposed by the tragedy, what are the deeper problems associated with Indian healthcare? What are the lessons that state governments should learn from this tragedy? GS Paper 2, Issues relating to development and management of social sector, services relating to health. What is the context about? The death of more than 60 children in the span of a few days in a major referral hospital in Uttar Pradesh has jolted the conscience of the nation. This was an entirely preventable tragedy. An inquiry should examine whether and to what extent the disruption of oxygen supply to those who were extremely sick was a cause for the deaths. The lack of political will to fix India's healthcare system unfortunately means that incidents like the Gorakhpur tragedy will continue to happen with morbid frequency across the country. As exposed by the tragedy, what are the deeper problems associated with Indian healthcare? At the top of the list is India's abysmally low public spending on healthcare. Public spending has increased but only marginally over the past 2 decades, from 1.1% of gross domestic product in 1995 to 1.4% in 2014. India's healthcare system is facing acute manpower shortage. The country has only about 1 doctor for every 1,700 patients, whereas the World Health Organization (WHO) prescribes at least 1 for every 1,000 patients. A vast majority of people do not have health insurance in a country where the public health system has collapsed. Health shocks are one of the biggest reasons why people slip back into poverty. India's inability to find a workable model for itself has left its poor particularly vulnerable. Most state-run facilities are so poorly managed that they aren't really an option. Private facilities may offer services, but there are serious quality issues when it comes to the poor. What are the lessons that state governments should learn from this tragedy? State authorities must be responsive to demands of people as part of good governance. With the increase in population, government should create new medical departments or hospitals to ease burden. States have to improve coordination between hospitals, state government authorities, third-party equipment suppliers. Powers should be given to local authorities to take decisions on important aspects like collecting required medical equipment, tools and other infrastructure. Adoption of technology to track the availability of resources, doctors, nurses, equipment, patients list, with centralized database of entire government hospitals. For better service delivery. Factors like empathy, sympathy towards fellow beings is required, especially in professions like medical departments, and the same should be inculcated in government hospital staff.